Do I need hip surgery? It's one of the most common questions I actually get as a therapist, and very honestly, I don't take it as an insult. The US has become very famous for our very liberal prescription of surgery, and until recently, PT was kind of seen as a bit of a brush off by your doctor. It means they didn't take you seriously at the time. But more cutting edge research, especially by the NHS in Britain, is really showing that the so called conservative approach is actually preferred, depending on the case and the type of injury. And more physicians are treating this as a first option to try and save patients the difficult surgical recovery in the long run, especially when that intervention can be avoided. So the question is, how do we know? How can we be sure? And the answer, of course, is, as everything else in medicine, it depends. For drastic injuries like muscle, tendon, and ligaments that have fully ruptured down the middle or have completely avulsed from bones, or severe fracture that can't be treated otherwise, of course we have no other option. But for things like arthritis, labral tears, and the various itises and osises of our body, the answer is much more complicated. The newest research is showing that for the vast majority of these cases, altering body mechanics and retraining tissue loading with very specific motion programs is actually the preferred treatment. It's fast becoming our first line of defense in this area. More people are seen to benefit here than from other interventions alone. So what we've been trying to do is not brush people off by avoiding physical therapy, but send you to someone like me to see if we can optimize your mobility and how you move. It means that the people who send you to us are keeping up with the newest data. They're on the bleeding edge of care. They're paying attention to you and what might be the fastest way to get you back, and that's a great thing. But we also acknowledge that most is not all. And the best indicator right now for a condition like any of the ones I mentioned before is that after attempting to optimize your strength, mobility, and stability, your symptoms just haven't changed. And that's our indicator that it's time for something more drastic. If you've tested your strength, your fine motor and mobility, and everything is above average, and things still aren't better, that's when we are encouraged to seek further care. So obviously, if you hear the word rupture and avulsion, you should definitely think surgery right away. Usually we're going to try the conservative approach first. We want to optimize movement, optimize and make sure that everything is correctly moving the way it's supposed to, that it's being moved along by the right muscles, that everything is balanced the way it needs to be. Because surgery isn't the panacea we thought it was, and recovery isn't a quick and easy thing. So something we're trying to do only when necessary is the surgical approach. If it is, we're absolutely going to push toward it. But we always want you to know that if you're sent to physical therapy first, it doesn't mean that you're not being taken seriously. What it means is that we think that you might not have to go through that, and that's a perfectly reasonable thing for your condition to try to expect some great results from it. If you have any more detailed questions on this, of course, forward them to us or towards your doctor, and we'll be happy to talk to you about the newest things that we're reading and the newest things that we're studying to see if we can get some cool stuff your way. Have a great day.